What if I told you that some of the things that you were doing every day could be damaging your gums? In this video, I'm going to go over 9 hidden causes of gum recession and damaged gums. So make sure you stick around for all of them. Because unfortunately, gum recession is irreversible unless you get some sort of surgery, but even that can be unpredictable. So gum recession is actually when your gums start pulling away from your teeth, and they'll start exposing the root structure of your teeth. This can lead to your teeth being more sensitive because your roots get exposed in there, basically these channels to your nerve, and also more likely to get cavities because your roots are weaker than your enamel. And it can also be less aesthetic if more of your roots are exposed because your teeth will look more yellow. So the first way that you're causing gum recession is brushing too hard. So ideally we should be brushing really soft because when we brush and floss our teeth, the only thing we're really cleaning away is plaque and maybe some leftover food particles. And plaque is a very loosely attached biofilm of bacteria to your teeth, meaning it's really easy to remove and you don't have to brush super hard to remove it. And you'll actually probably clean your teeth better by brushing softer. Now, if you brush super hard, yeah, you're gonna clean your teeth, but now you risk scrubbing away your gums. And you could also potentially scrub away some of your enamel. This over time can keep irritating your gums and slowly lead to that gum recession and even lead to some punched out lesions on your teeth. And these might eventually need fillings or just might be unattractive later on. Now this also brings us to number 2, which is using a hard bristled toothbrush. Your toothbrush should always be a soft bristled toothbrush. I actually don't even know why they make medium or hard bristled toothbrushes, because they shouldn't be used for your teeth. And it's the same reasonings I said before. You only need a soft bristled toothbrush to adequately clean your teeth. Otherwise, you're just going to be doing more damage than you need to. I recommend actually using an electric toothbrush. I just feel like it's a lot easier to navigate around the mouth. And you don't really have to focus on brushing in circles. With an electric toothbrush, you can just hold that electric toothbrush against every single one of your teeth individually. Because with the manual toothbrush, you're supposed to be brushing in circular directions at a 45-degree angle, but it's really easy to start scrubbing super hard on accident and then slowly damage your gums. Now, those first 2 ones were kind of obvious, but number 3 is clenching or grinding your teeth. Not so obvious anymore, right? So if you clench or grind your teeth, you're putting a lot of excess pressure on your teeth. So not only is this going to lead to your teeth chipping and getting flatter and potentially cracking, this can also cause those gums to recede from all that stress. And part of the reason for this is as you're putting all that stress on your teeth, it can lead to more inflammation in your gums, which can start to eat away at them. And also kind of similar to brushing too hard, if you grind and clench your teeth, it can lead to something called abfraction lesions. Now, abfraction lesions are a little different though, because abfraction lesions are these punched out lesions right by the gum line. But the reason that these happen is because you're basically putting these flecks on your teeth. So as you're putting all that stress from grinding and clenching, it can lead to these microfractures right by that gum line, because that's kind of the midpoint between the top of your tooth and the root of your tooth. So right there is where it becomes a weak point and really easy for there to be some fractures in there and for that lesion to form. Also, grinding and clenching can lead to TMJ issues where you have jaw pain or headaches or ear pain. The simplest solution to grinding and clenching your teeth is getting a night guard made. You can get a custom one made at your dentist where they basically scan or take an impression of your teeth, and then they make this thicker piece of plastic that either goes on the top or bottom teeth. And then that way, whenever you grind or clench your teeth, instead of scraping your teeth away, you're actually just putting all that pressure on that plastic. And the good thing here is that plastic will deflect all those forces. Some people ask me if they can get an over-the-counter mouth guard made instead of getting a custom one made at the dentist. Yeah, you can do that, but it's not going to be as good, because when you get a custom one made at the dentist, they will actually make it so that your bite is even on that piece of plastic, versus if you get an over-the-counter one, you could be hitting harder on the right side and not so hard on the left side. So you're putting excess pressure still on one side. But the custom-made ones at the dentist are meant to actually deflect those forces and not put that stress on your teeth and your jaw. Now, these TMJ issues and grinding and clenching could also be sleep-related. And studies show that it could potentially be because of sleep apnea or some other airway symptom when you're sleeping where you're struggling breathing properly. I actually made another video more on the link between sleeping and breathing and grinding and clenching your teeth. So I'm putting a link to that video in the description below, so make sure you check that out. Now, the 4th cause of your gums receding is gum disease. Again, this one might be a little obvious, but basically you gotta have a good oral hygiene routine. brushing and flossing, and also going to your dentist every 6 months. If you're not doing these basic things, then you're not going to be removing the bacteria that get underneath the gums, which can eventually lead to pocketing, which means that pocket gets deeper around those gums. Those are the pockets that your hygienist measures every time you go for your cleaning. And this will also allow more plaque and tartar to build up, and all of this will just lead to more inflammation and eventually lead to more gum recession. Number 5 is smoking and tobacco, or even just nicotine use alone. Whenever you smoke or use a tobacco pouch or just use like a Zyn, which is straight nicotine or something like that, all of these are going to be damaging your gums in some way. So smoking and nicotine will constrict your blood vessels, and this will lead to less blood flow getting to your gums, meaning your gums will be less healthy because they're not going to be getting all the nutrients that they need. And this also impairs your gums' ability to heal, and it makes it harder for them to recover from infections and prevent infections, and also heal from any damage. Like if you brush your teeth too hard and then now your gums need to grow back and heal from wherever you brushed too hard in that one spot, well, it's going to be harder if you have nicotine or if you've been smoking. Smoking and tobacco will also weaken your immune system and kind of further worsening the things I just talked about, but also put you at a higher risk for getting severe gum disease, something called periodontitis. Periodontitis is where that gum disease doesn't just affect your gums, it also affects the bones and the support structure around your teeth. So not only are you going to get this gum recession, you're also going to get bone loss, and your teeth could potentially get more mobile. Also, all these products can lead to a dry mouth. And saliva is super important for your teeth and gums. Your saliva has a lot of antibacterial properties, and it can also wash away a lot of the plaque and food particles and bacteria on your teeth and gums. And your saliva can also buffer the pH in your mouth. So if you don't have saliva, it's going to lead to a more acidic environment in your mouth, which is good for the bad bacteria that are leading to damage in your mouth, but it's not good for your teeth and gums. Number 6 is if you have any piercings. No, I'm not talking about a nose piercing or a belly button piercing or wherever else you get your piercings. Mainly talking about piercings on your lip and your tongue area. Anything that constantly rubs against your gums or your teeth, especially if it's a foreign object, will eventually lead to damage, because this will constantly be irritating your gums in that area and constantly lead to more and more recession. I see this all the time where someone, if they have a tongue piercing or they have a lip piercing, and part of that piercing is just constantly touching their gums, then their gums in that area are really, really inflamed, or their gums really start to recede, and this can potentially lead to a lot of other complications. Because the more you lose those gums and the more irritation and inflammation you have, the more you are at risk of losing that tooth. And this is especially the case with those lower 2 front teeth. If you get a piercing by your lip or your tongue, usually those 2 lower front teeth are the most affected teeth. Those teeth are also the smallest teeth in your mouth, and that means that it's really easy, if something happens to those teeth, it's really easy to potentially lose those teeth. And if you get a lot of bone loss and gum loss in that area, you could lead to those 2 front teeth getting more loose and eventually losing them. Now, this could happen to any other tooth as well if you have a piercing somewhere else, but those 2 lower incisors are the most susceptible to damage. Now, number 7 is having misaligned teeth. So if you have misaligned or crooked teeth, it also means you have a misaligned bite. And ideally, we should have an even bite, where our teeth should be hitting harder on our back teeth, on our molars, and softer on our front teeth, because our back teeth are meant to do this clenching and all the heavy lifting, but our front teeth weren't meant to do a lot of that. You also want an even spread on the left and right teeth in terms of how much biting pressure you have. But unfortunately, almost everyone right now has some form of misaligned teeth. Some people's teeth are obviously more severely crowded than others, but an uneven distribution on your teeth, similar to grinding and clenching your teeth, can eventually cause gum recession. On the flip side, if you get braces or Invisalign, this can correct this a lot and make your bite more even and also align your teeth better. But that's only if it's done correctly, because if braces or Invisalign or some other clear aligner is done incorrectly, it can actually lead to more damage and lead to more gum recession. For example, if you move your teeth too quickly, then this can cause gum recession. So I would definitely avoid products that are direct to consumer, like Smile Direct Club, which I know they filed for bankruptcy last year, but there are some other similar products out there right now where they're not overseen by a doctor. They just ship you something to take an impression of your own teeth, and they ship you something to align your teeth properly. If it's not overseen by a doctor, then chances are they're not going to do it properly. So definitely make sure you either go to your orthodontist or go to your dentist and make sure that things are done properly so you avoid at least them getting worse. Now, the 8th cause of gum recession is hormonal changes. Pregnancy, menopause, and even menstruation can all cause significant hormonal changes in your body. And all of these can directly impact your gums. There's a term in dentistry called pregnancy gingivitis, where you have more gum inflammation, you have more swelling, and you have more bleeding, simply because your hormones are thrown off during pregnancy. So what can you do? Well, just know that during these periods that your hormones can directly affect your gums. And sometimes you'll have to be extra gentle with your toothbrush and with cleaning your teeth. And sometimes you'll have to be more diligent with cleaning your teeth because you'll be more susceptible to inflammation. You might also want to take more frequent trips to your dentist to help clean away the plaque and lower the inflammation as much as possible. It's best to talk to your dentist if you're concerned about this because everyone's mouth is really different. Now, the 9th cause of gum recession I want to talk about is using whitening products incorrectly. So a lot of whitening products are generally safe and they do a really good job of making your teeth whiter and making you happier. But if you use these products incorrectly, it could damage your gums. A lot of these products are not safe to put on your gums because the concentration of the hydrogen or carbamide peroxide is way too high. That doesn't mean that actual hydrogen peroxide is bad. It's actually naturally produced in your body, and a lower concentration of it is actually good for your gums, and it's a really good antibacterial. But these whitening products use really high concentrations. Even like a concentration as low as 10% is still way too high for your gums. So if you're gonna do these whitening products, make sure you do them correctly and take any necessary precautions to avoid them from touching your gums. So that's all I had for you guys. Thank you guys for watching. I hope you liked that video, and make sure you hit that thumbs up button and subscribe to my channel below. If you want to quit smoking, it can be overwhelming on where to begin. And the reality is you might need a little bit of help, whether it's vaping or smoking cigarettes. Estimates are that people that try to go out and just quit smoking on their own without any outside help, only about 5% of those people are successful. But the good news is with modern medicine, there are a few very effective